neurology and adult health. Tonight, On Call with the Prairie Doc. Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Aberdeen Asthma and Allergy, Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Care, Dakota Dermatology, the Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, and Swiftel Communications. Closed captioning for On Call with the Prairie Doc is provided by the generous support of Avera, Brookings Health System, and Fishback Financial Corporation. The special health concerns we should have as we grow older, and what all does our nervous system do? It is your chance to ask the experts about neurology and adult health. We're On Call with the Prairie Doc.
Good evening and welcome to On Call with the Prairie Doc. The topic for the show tonight is Ask the Experts About Anything, Neurology or Adult Medicine. Medical questions might be about the flu or high blood pressure or what makes a person tired all the time, or even, do we really need to worry about Ebola spreading into the U.S.? There's no question a general internist cannot answer, excepting obstetrics maybe. Questions to ask a neurologist would include, what is peripheral neuropathy or Lou Gehrig's disease, or why do people get MS or Alzheimer's disease or meningitis? Is there a neurologic disease that we see more commonly in rural states like South Dakota? Questions like that. Tonight's guests include a wife and husband medical team. Lori Weissensee is a neurologist working at the Hot Springs VA Hospital, and Kevin Weiland is a general internist working at the Rapid City Medical Center with 60 other physicians and care providers in that group associated with regional health. It's a pleasure to have the two of you on the show. Tell us a little bit about yourselves. Lori, where are you from originally?
I'm from Sioux Falls originally, and actually I work for the Black Hills Healthcare System, VA, and primarily at Sturgis, not Hot Springs.
Okay.
But part of the Hot Springs is part of
the VA system.
And those patients from Hot Springs will come to see me at Sturgis. Mm-hmm.
So you mostly see veterans?
I see only veterans and Department of Defense.
Right. And are these mostly older people that you see right now?
Oh, no, I have the spectrum. We have, of course, the young folks coming back from from Iraq and Afghanistan, yes.
There's a lot of head trauma.
Yep.
You're seeing a lot of that.
A fair amount of traumatic brain injury. Yeah, sad stuff.
Yeah, that's tough. Where did you train?
I went to medical school at the University of South Dakota, and I trained in Madison, Wisconsin at the University of Wisconsin.
Yeah, yeah. And that's where you did your internal medicine?
Yes, I did an internship in internal medicine, and then did my residency in neurology. And then I also went on to did training, and I'm boarded also in pain management.
Oh. Do you do a lot of that at the VA?
I do. Well, just as yes, we have a pain clinic, which I'm separate from, but of course in neurology I take care of a lot of pain.
Yeah. And so where did you meet this character? I mean,
over my dead body.
Oh, is that right?
Gross anatomy.
Oh, there it is. Yeah. Over your dead body.
And actually, in the date.
Gross anatomy is the study of the dead body.
Exactly.
You're dissecting.
And
the
we
body.
met on 8/8 of '88 at 8 o'clock.
No kidding.
I'm not kidding. That's our first day of med school.
Over a dead body.
Over my dead body.
Okay.
Well, it was hers too. We were partners.
Yeah. That's a great story.
Yeah, it is.
I bet you've told it a few times.
I won the lottery. I got into med school and I met her. Seriously.
Yeah, there it was at the same time.
Oh,
so you
wonderful.
were married what year then? Did you go all the way through med school?
After med school. After med.
Yeah. Right before residency.
1992.
Yeah. And then she went over here, and then you went. We both went to
Madison, Wisconsin.
Oh, so you did your internal medicine in Madison?
I did.
Were you a hoofer at the Hoofers Club at the University of Wisconsin?
Is that where they drink beer?
That's where they drink beer.
Then I probably was.
And a hoofer was the sailboat thing. I taught sailing at the university.
Sailing. Oh, yes.
I taught sailing at
yes.
the Hoofers Club at the University of Wisconsin one summer.
Wow. Wonderful. Yeah.
Yeah, it wasn't didn't pay well.
No, I doubt it would.
But it was great fun.
Good.
So, and of the things that you do in medicine, you are also a member of the Foundation for Medical Care. Tell us a little bit about that, because the Foundation for Medical Care is one of our major sponsors, and has been so for 13 years now.
And I've been with them for about 13 years as well, and so I'm the treasurer for the Foundation for Medical Care, and essentially it's just a kind of an organization to kind of help doctors to kind of make sure that things don't fall through the cracks with patient complaints. We actually are the board that actually looks at a patient complaint. We can actually say, well, Dr. Weisensee, would you mind reviewing this case? Dr. Holm had a patient that had a big complaint on. Would you please look at that and see if Dr. Holm met the quality of care?
Did Dr. Holm do the right thing?
Exactly.
And
So
you asked the reviewer to
Peer
review it.
review.
Right.
Sort of.
So it's
Yeah,
peer
yeah,
review.
yes.
Peer review.
So we're watching our own
Exactly.
self.
Yes.
Do you truly think that there's all these people saying doctors aren't watching after themselves?
No, this foundation is really right on top of it. And we're also looking at quality of care measures. We have the scopes of work for diabetes, for immunizations, for pneumonia shots. So it's really truly a volunteer program for me to be a part of. But
Yeah, they pay you the big
yeah,
bucks, don't they,
yeah,
for
they
that?
pay us the big bucks. But we're glad to see us sponsor shows like yours. And we're glad to see our community doctors take care of our community, and that's where it's gone.
So,
we're really a great role model.
For the Healing Words Foundation, which is the basic group that organizes this, and I can't tell you how much I appreciate the
Thank you.
foundation.
Thank you for what you do here.
Make sure that
this is great.
they all hear that. They're not watching. They should be watching.
They are watching. I make sure of that.
So, anything that you would like to say about the VA hospital, Lori?
Well,
I mean, there's
it's-
all this
all
stuff
this
about-
Oh yeah, no, it's a great place. It's been a good adventure for me, and I enjoy taking care of veterans. It's a privilege to take care of veterans. I think we have a great VA out here, and nationally we're rated very, very, very high in patient satisfaction. So I think it's a fabulous place.
Right. You can give us a call at 1-888-376-6225 or email your questions to ask@oncalltv.org. Or you can ask us on Facebook or Twitter. I understand. I have no idea how. But please give us a call, 1-888-376-6225, and give us your call. This is your show. This is the Stump the Expert show. This is the Ask Anything. This is anything you can. I dare you to find something that these two don't have an answer to.
We know it all. Just
Yes,
takes forever to remember it
Right.
Yeah.
anymore. So that's why I brought her along. I brought her along for a reason.
That's right. So, but I wanted to talk about waits at the VA. I know there are people that talk about waiting at the VA hospital. What is your comment about the waiting? Is there a long wait to get into where you work?
No. I have been compliant all along, and I believe for the most part our VA as well. I don't think it's really a regional problem here.
In South Dakota, even in Sioux Falls, is there a wait?
Well, I can't comment about Sioux Falls. I don't really know much about them, but I haven't heard of anything of a problem anywhere in South Dakota. Obviously there was some stuff that, nationally, but I think we're on top of it. I really do think they're on top of it.
So there's this big swing, in the country. You could hear it kind of the door swinging, saying maybe we should privatize and let the veterans go to private health care. What's your comment about that?
Well, we already do let them go to a fair amount of, because we can't offer all the services, particularly subspecialty services. So we do fee-based, and in fact, if we can't get them in to see a physician, let's say orthopedics, for instance, if they were out past 14 days, and there was a need to get that patient in sooner, then we will fee-base them to a private sector.
Okay. So
Yeah,
that's it.
it works.
All right, and I know that you are a generalist who does
Like you.
mostly outpatient,
Like
though,
you?
right?
Yeah. Oh, you do inpatient? I do just outpatient.
I do some inpatient.
Oh, okay, good.
But
Good for you.
outpatient. So, and what are the things that you see the most of?
Well, what is two main in your practice. I mean, the causes of the most of the diseases in our society is everything
Lifestyle.
related to lifestyle, exactly, obesity and smoking. So yeah, we see a ton of this, and it's been a focus of my practice. And I used to write a column once a month. I compiled my columns into nutrition and wrote a book. And so, I mean, these are the things that I really feel passionate about. And I think with what has changed in medicine with the Affordable Care Act is that they have focused a lot more on primary care. We're able to now afford a nutritionist, which my group is now going to do. We're going to be able to focus on more nutrition and lifestyle changes rather than treating the end result of that, treating with the high cholesterol meds, treating these very expensive drugs for diabetes, and focus that money ahead of the game here and try to focus on that and see if we can change the lifestyle and change the course of our healthcare.
Now, the gist of your book was on diet. I mean, I know that you said a lot about activity and being outside and
Yeah.
being in,
And it's in my book too, yeah.
That's
absolutely,
in the book too.
yeah.
But what about the diet? What is the diet that the people listening today should be eating that they're not?
Well, whatever they're eating, no matter what, eat less of it, period.
It's just less of whatever you're eating.
everything.
It's the calorie count.
It is calorie counting, absolutely.
That's
and
the biggest
It is the
point,
biggest
isn't it?
thing, but what you do eat,
Quality.
go ahead, yeah.
No, quality, of course. I don't mean to interrupt, but quality.
Yeah, you do.
Yeah, I
We're
do.
married.
Yeah.
Let me
used to it.
talk.
I don't
Let
mean
me
to
talk.
interrupt, but will you shut up? Let me say something.
Yeah, no.
So, no, I'm sorry. So, what do you say
Well,
is quality?
quality food.
There's a lot of argument about that.
There is a lot of money, but it sort of gets back to basic principles of whole foods, and fruits, vegetables, lean meats, grains that are that's controversial a bit with some of the new gluten stuff. But if you're not gluten sensitive, then healthy grains, berries, nuts, those sort of things. Avoiding the simple sugars, and that includes. When I talk about simple things that turn into simple sugars in our body, like white flour and things like that stimulate insulin and insulin resistance ultimately.
Right.
Which is metabolic syndrome.
Metabolic
which is basically
syndrome, yeah.
what we're talking about.
Right. So basically, and I've heard it over and over again, a low carbohydrate, people lose weight, they feel better, their diabetes gets better, their less cholesterol drops, everything works better. And if you go on a less carbohydrate diet, carbohydrates are sweets, breads, potatoes, pastas. Am I hitting it?
You're hitting it. You're hitting it. That's it.
And so if we could cut
above.
out all that, I had one guy lose 40 pounds, and he said, I just quit up bread. I'd have a hamburger without the bread. So his breakfast was cottage cheese and then eggs and sausage.
Sure.
No hash browns.
That is a lifestyle. It's a difficult lifestyle in the life we have. But I think it's like anything else. You just have to do things smart. I mean, you have to say that those kind of things can contribute to elevated blood sugar. So I'm not going to take an excessive amount of it, or I'm going to minimize the amount of that I eat.
Right. And you were saying, I'm not quite in agreement with this low carbohydrate diet.
I
What's your
am not. Basically, we have this length of lifetime. We're making in the whole history of the world, we're making the best breads ever in the history of the world.
The best breads.
The best breads. Am I going to give that up? I don't think so. To live an extra couple days, I don't know.
No.
I mean,
Yeah.
Well, that's what I was saying about be smart.
But be smart.
Don't overdo
but
it.
don't overdo anything. You went to Emory, Atlanta, Georgia,
Yeah.
home of Coca-Cola.
Yeah.
I love Coca-Cola. I used to have a soda fountain. I have a soda fountain. I make cherry Cokes the best. Do I drink it every day? Absolutely not. So you really have to back down and moderate on some of these things. But back to this low carbohydrate diet, I had a patient, I write about it in my book, who ate bacon every day. That's all fat and protein. He ate bacon every morning, and he came in with acute pancreatitis because his triglycerides were over 2,000.
Right.
He ended up hurting his pancreas, causing his insulin islet cells to get out, and now he's diabetic.
And the point is that what I think you're saying, and I really do agree, is that it's the calories that matters. It's the quantity of food that you eat that is really the biggest problem. Of course, it would be good to eat better quality, like whole fruits, a nice balanced diet of fruits and vegetables, and so on, and maybe even
and even to segue into this, the brain is about 80% fat. Some have a little bit more,
Yeah.
and some have less, but 80% fat. And there's good fats in there. If we deprive that developmental nutritional essential fat, we may end up with attention deficit disorder in kids, which I do mention in my book. We may end up with Alzheimer's, multiple sclerosis. So this
yes.
essential fat is very important.
All right.
So that don't eliminate those either.
Don't eliminate certain fats.
Yes.
Jim.
No,
Yes.
no, no.
All right. Teresa Binkley, a former med tech in Brookings, was shocked when she was diagnosed with leukemia in 2009. She fought hard, and because of a stranger thousands of miles away, she survived the disease.
It started in the fall. I think I was just feeling like I got to get back to the gym and I have no energy kind of thing. An interesting symptom I had was my gums were swollen. And of course I went to the dentist. And we tried some antibiotics that kind of helped, not really. And it was just after Christmas that I came up 3 flights of stairs. We didn't have an elevator in the building at this time, and I just thought I was going to have a heart attack or die or something was wrong. And Bonnie, my supervisor and friend, said, I got to find a doctor, there's something wrong with me. He took some blood tests and asked me to wait, and when he called me back in and told me my white count was high. I had been a med tech in the past, so I knew what a normal blood count should be. And I knew it should be between 5 and 10,000 per whatever unit. And he said it's 119,000. So I knew, I believe I said right away, so I have leukemia.
I was fortunate to have been given the opportunity to look after Teresa. She's a wonderful person. We've had a relationship going back to 2009, I think, when she was first diagnosed.
It's interesting because I grew up in Minnesota and all of my family was, well, aren't you going to go to Mayo? Aren't you going to Rochester? I said, no, I think I'm in pretty good shape here. I liked the treatments he suggested, and I liked the way he explained things.
I've had the fortune of serving so many patients, and many of them have impacted my life with their positive attitude and their courage.
So then the treatment plan we first tried, I have 4 brothers and 2 sisters, and none of them matched for a sibling transplant. So then the next step that was the least risk would have been to do the chemo, several rounds of high-dose chemo, which each round was a month in the hospital. So in August of this past year, I found out that my donor was Marcus Iberly. He lives near Munich in Germany. And I was given his address, street address. So I wrote up a letter and I sent my email address to him. And he emailed back. I was so tickled that he emailed back. And in the process, we've exchanged emails several times. We really hope someday to be able to travel and meet him in person. I was diagnosed with AML in 2009, the end of 2009. And today I am 2 years and 8 months post-transplant, which is actually a little over 4 years from when I was first diagnosed. The following September, my daughter got married in September of 2012, and so I got to be at that wedding. In between the 2 weddings, of course, my grandson came. So all of these things that life is all about, I got to be at and experience, and all because of I think, an exceptional doctor and care team, and a young man in Germany who was willing to donate stem cells.
Thank you, Teresa. That was just the most beautiful story. And of course, dear friend, I always wished that my oldest son would marry her oldest daughter. They're a beautiful daughter, and it didn't happen. But it's nice that Teresa is alive and well, and it's really neat that that there was a donor that match.
In Germany?
Yeah, isn't that? Well, it's an international deal.
Yeah,
it is.
You know, the fact that we can actually cure these. I mean, when I started, they were dying. There was nothing we could do. I mean, you guys are a little younger than I am.
When we trained in residency, we had bone marrow,
big time.
transfusions.
Bone
Oh yeah,
marrow.
yes,
Yeah, big
transplants.
terrible.
Yeah.
Yeah, we
So
shared call together then.
That was that was a rough time.
rough time.
Well, yeah. I mean, people that transplant. That's a tough time because they're very, very sick.
Very sick, very sick.
What I find amazing is that people don't get a physical anymore. If they don't go in and get a routine blood panel, you can pick this up earlier, way earlier, before anything major can happen. Just a simple CBC, a simple complete blood count, looking at your white cells, looking at these sort of things, looking at these indices in one panel.
But see,
to pick this up.
Right. But the whole system has said, don't do screening blood work hardly. You got to have an indication.
Absolutely, it's crazy. My indication for anyone for a CBC, and everyone has fatigue.
Yeah, I got nowadays.
Everyone has fatigue.
Don't we all have that?
Oh my gosh.
Oh my gosh, fatigue, check a CBC.
Oh,
And
I need a CBC and a panel B. And then you do that once a year. And just do the right thing.
Absolutely, and that's all it takes is just see your primary care physician, get a CBC done. It's that simple.
And tell them, well, if you could do a CBC, because I've been feeling a little tired lately.
Yeah, I was on call last night. Of course you're tired, but that's a good reason.
So what's your comment about leukemias, Kevin?
I don't know. Just recently, I've just been picking up a lot more in my own clinic, and I'm almost, it's not just leukemias, but other bone marrow dyscrasias, like multiple myeloma, and I don't know what's going on. I mean, I'm not scaring the public here or anything like that.
No.
Maybe I'm just more attentive to it, but these things can be picked up early, and I'm really amazed. Like I said, the treatment plans are curing people. And I don't know the cause of all of this. This probably is genetic, and they do know a lot of that, but.
Although my sense is that when people are exposed to industrial cleaners or lots of chemicals, and of course radiation is
Absolutely.
and how many, that brings us to how many CAT scans have you had? I mean, one CAT scan is 200 chest x-rays.
Right.
So I worry about everybody's eagerness to get a CAT scan.
I know, I agree.
Yeah.
We have a question from Sioux Falls, 88-year-old person, 145 pounds. Glucose is 125. Should I be concerned about eating one candy bar a week?
I think she ought to enjoy her life. I think 2 candy bars a week.
2 candy bars. How about 3?
It's all about a treat.
But
A treat is rare.
But for her, the long term, to really be realistically, the long-term problems with high blood sugars takes 20, 30, 40 years down the road. Now, she can yell at me when she's 120 and say, Dr. Weiland,
why did you
tell me to have that candy bar? Now I can't see. I don't have.
It's your fault. But 88, my goodness,
88, that's
125
Enjoy
glucose.
life.
Enjoy it.
That's a wonderful.
Wow.
Good for her.
Good for her. That
Good
means,
for her. If my patients had a blood sugar like that, they would be rock stars.
Don't worry.
So I would say the most important thing, and I know that we talked a lot about food earlier, but I'm a fan of exercise. I think exercise is the cure-all, and so just do a little bit more walking and maybe 2 candy bars a week.
There you go.
So we have another caller. This is, what does practicing medicine mean? How can we improve access to rural medicine? That's a great question. You guys are kind of rural, Rapid City. Brookings is a little bit more rural. People think rural is Badger and, Irwin.
Right. Well, our practices are primarily we bring people in from rural areas to see us. So we're not the example of that, but I absolutely, South Dakota is all about rural, and our medical school promotes rural medicine placement, and
they do a great job.
They do a wonderful job, and I think we have mid-levels also. We have nurse practitioners and PAs that physicians can oversee that are very helpful in our rural communities, and that's part of medicine as well.
They work with us collaboratively.
And another access point is telemedicine. I mean, that smartphone that what you can see and what you can, the details and the high definition for a rash or a tonsillitis. I've diagnosed my nephews who don't think they need health insurance. They call me up and say, "What do you think of my throat?" And they do a selfie with their mouth wide open. And I would say, "Hey, you got tonsillitis.
You need to be seen."
You need to be seen. Yeah.
I had a gentleman who had a brain surgery done at the Mayo. This was his second brain surgery. And he was deteriorating, and I said, "You're coming over to the emergency room." I saw him in my clinic, and the wife was just had it, and the Mayo is a far piece, and they had seen him maybe a week earlier, and I said, "Come to the emergency room." We got the CAT scan, we looked at the X-ray, and I thought, this is worse. There is fluid collecting on that side of his brain, and so I called the surgeon. The neurosurgeon on call actually was a resident, senior resident neurosurgeon.
Yeah, sure. Yep.
Right? The chief resident.
Yep.
And she said, "Well, you got a smartphone on?" I said, "Yeah." "Well, take a picture and send that to me. Here's my mobile number."
Isn't that great?
Boom, 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 took the picture. She said, "Oh, I've got that in comparison to the one that we had just recently." "Yep, send them."
Wonderful.
We'll do it. In fact, we'll send them by a fixed air wing. You know.
Great
Isn't that a
story.
neat techie story?
Yeah,
I love
that's
that.
a great
I
story.
like that.
So I
yeah.
just took out my mobile phone and took a picture, and there it was. That's called telemedicine.
It is telemedicine.
Yeah.
Yeah, in the right hands. That's great. That's
But
a
they're
great
doing
way
all
to
sorts of
deliver it.
other kinds. I mean, do you do
The VA
telemedicine as a neurologist?
They're attempting to set that up for me, but it is very big in the VA, and it hasn't been established yet in my clinic, but they're working on it.
Comment. Caller's husband had awesome care at the Sioux Falls VA hospital. He's 85 and doing very well today. A comment.
Great, thank
Good
you.
to hear
That's
that.
nice to
Yep.
hear.
And-
I
and-
Here's
appreciate
the sixth story.
So, and this is one, this is Proposition 17. What is your opinion on 17? Of course, are you an employee of Rapid City Regional?
I am not.
Who is your employer?
I am private medicine.
Private medicine?
doctor. Yeah, it's just me.
Well, what is Proposition 17?
It's a patient choice for doctor patient. And I guess the sanctity of my office has been my relationship as yours with our patients. And so, but I kind of get worried about the one side of the proposition where they are saying big government's going to come into view and so vote no on this, but they're more interested in their insurance companies. And on the other hand, the patient choice, the surgical hospital that you might want to choose, I worry about that. That's sort of skewing some of this, but
It's a complex.
it's very complicated. Yeah, so I
complicated.
think the patients, but really it comes down to that sanctity between the doctor and the patient. So for me, I have to vote yes.
I know the State Medical Association, and I'm on their old President's Club organization, and we met and talked about this. Had great,
But young at heart.
young at heart, of course. And I do think that for the most part, the physicians in the state of South Dakota are very much in favor of Proposition 17 that says you can pick your doctor. My personal thought is that if you pick your doctor and you say to the doctor, okay, you're an orthopedist from Sioux Falls, but you're coming to Brookings, I would like to have that surgery done in the Brookings Hospital, you should be able to choose that too.
Absolutely.
Yeah, so
I think patient's
good
choice
point.
is really one of the things that I can't
Patient's
see.
choice.
I
Patient's
can
choice.
disagree. Now, I don't know. I suspect that Avera, who we love dearly, and because they're sponsoring this program, and we can't get by without them, and we do appreciate all the good things that they do, are not in favor of it. Right. But part of that is the cost, because that's their insurance industry worries about controlling costs. Dakota Care itself is in favor of it.
Oh, dear. Okay.
Well, they also worry about those patients in their network leaving to see another doctor outside of their network. And those doctors are now scrambling for patients. And that is a concern for the doctors in the network.
Right.
So I do see that side of it as well. But if you're a good doctor, if you have a relationship with a patient, just because they change health insurance plans should not mean they should change their doctor.
Right.
That is not a pre-existing condition. They should be able to follow that doctor because that continuity reduces medical liability if you have that relationship. And you know that and I know that.
That's right. How successful is surgery on hammer toes and Morton's neuroma? Now, you know Morton's neuroma. Tell us what that is.
Yeah, we need a podiatrist here, but how hammer toe? It's very successsul.
Hammer toes are very successful.
Yeah, hammer toes are. Morton's neuromas. I see a fair amount of people that are referred to me from the podiatrist because they have refractory pain despite having the surgery. I think you rev up the nervous or the peripheral nervous system sometimes when you end up cutting around precious little nerves like that, and they get irritated, and you have persistent pain at times.
Although people run on those feet, they bump around on their feet, they have arthritis in those feet, they still stomp around on those feet. I mean, people get neurologic pain in the bottom of the foot because the metatarsal heads push up against the
Right.
nerve that's trying to go in between there.
And
It's
the older we get, the less we have in there is fat pads in our feet as well.
The cushion.
So, exactly, and so it gets worse with age.
Now, because I married a neurologist, which I love, because I always call her up, say, "Honey." So I'm going to ask you right now. I mean, are there medications like Neurontin or gabapentin
Sure,
or
there's
that can help?
Yeah, all the above what you just said. Then those kind of medications that work on nerves.
the gabapentin.
Gabapentin, pregabalin.
cheap.
The old-fashioned tricyclics, amitriptyline, nortriptyline, and some of the other seizure medicines work as well. Yeah.
I just read an article that said the truth is I can't even, it could have been for with peripheral neuropathy. Amitriptyline should be the first thing. It's pennies a day. I mean, it's just a cheap drug, but it's on the Beers list, and it has some side effects. Kevin, tell us about
Just
that.
the dry mouth, but the biggest complaint is that. And then some of the anticholinergic side effects, and especially in the elderly, hallucinations and sort of those
But at 5
things
or
that
10
happen.
milligrams, you can get by.
If it works, you have to
not
titrate up,
150
obviously.
that you
Right.
use for depression. The old.
Do you use it a lot?
Boy, when I was, 1980s through the 90s, I used a lot of it. And then, of course, the Beers list saying it's a dangerous drug moved me. They
Right.
switched to nortriptyline. And I still use a fair amount of it, but not as much. Nortriptyline is a little bit more common. I'm using low doses gabapentin now for those things, instead of pain medicines like narcotics and opioids.
Yes.
Right. I have a question about ALS, Lou Gehrig's disease. Tell me what that is.
Lou Gehrig's disease is a motor neuron disease, and it affects people typically in mid-age and more often males, but there are females as well.
And it's
devastating because at this point in time we don't have a cure for it, and we have ways to comfort people through their death, but it is difficult. Eventually, lose the ability to breathe, and it's all muscles that are weakening.
Weaker.
But
But they're alert. I mean, that's what the worst part of it is.
Well, they're alert, but there is an associated frontotemporal dementia that can go along with it. But for the most part, most people are alert and aware.
I think they're challenging you to an ice bucket there.
Was there
On that little note there. I'm just kidding.
Don't.
I'm just teasing.
Don't bring it up. We did bring it up on our show, but we didn't get a lot of response, and it was just at the end of the ice
Yeah.
bucket.
Did you do it?
Yeah, the ice bucket. Okay.
I didn't get enough response. I said, I'll do it if
I'll
I
do it, sure.
Okay. Ken Ivers was diagnosed with Parkinson's disease 14 years ago. Since then, he's begun using the Lee Silverman voice treatment, or LVST BIG program, which was developed in 1987, and his results have been life-changing.
It's progressive, so the symptoms have come along in time, and then they change. Starting at the most current, right now I'm experiencing what they call frozen foot, one foot that's heavy and it won't move, which is very exasperating, and I'm hoping that's one that'll pass soon. But many of them are cumulative. I've been fortunate in not having some of the most severe symptoms that some people have. And secondly, I've been able, through really hard work and exercise and eating right and getting enough rest, to ward off some of the bad cases. I don't have trembling. In fact, when you see me out playing tennis, you would know what it is. And if it wasn't for this program, I would be in very, very bad shape, because I was getting worse and worse, and I wanted to sign up for this, and I couldn't get in because we were still wintering in Florida. As soon as they put me in the program, we start training. And that's 4 weeks long. And after the first 2 weeks, I noticed a significant difference in who I was, what I was doing. Speech came back much clearer. Confidence in movement was there. In fact, when I asked My friends in church asked, what do you notice is different? And they seldom pointed to the movement. They said, your voice, we can hear you now. I've recommended it to so many people. In fact, there's one, he may end up listening if he hears this, that I saw him in the, I was doing a workshop someplace, and he attended. And I noticed that he was having a terrible time with but mostly his wife was having trouble with him, his problems. I saw him in the store sometime later, and I said, my exact words, I said, there's nothing you're doing in the next 2 hours that is as important as you're getting over there, getting your butt over there and signing up for this thing. He went and did it. He's a changed man today. So everything is exaggerated. I talk to and I exaggerate. When I take a walk, if I can walk, shuffle, that's the disease working. Or I can take a little bit bigger step, nothing's happening. But take the right big step and it's saying, hey, buddy, you have to take this kind of step if you're going to intervene. And if you keep that thing in mind, it keeps you on track. I feel lucky to be living in a time when medicine is so good. I feel fortunate.
Thank you for that, Ken. That was absolutely very, very important. And I've seen a change in him at church.
Great.
I see him at church. He's in my my Hopeful Spirit chorale. We sing on Tuesday nights for someone in need of a little bit of hope. And he's just he's moving better. Any thought about big therapy?
Well, that therapy is offered, and I have a speech therapist out at Fort Meade that works. Amy Jost does a beautiful job working with patients, and a lot of it has to do with movement. And as we know, Parkinson's disease is a disease of poverty of movement. Everything slows down, gets tight, rigid. And so you're trying to open up things and move, and air volume flows more smoothly across the vocal cords, of course, if your chest is open and you're moving. And there's numerous studies and some big studies of recent times that shows that the folks that do the best with Parkinson's disease are the ones that are physically active.
Right.
Aerobically physically active.
Yeah.
Yep.
And I would say that goes for
Every
disease.
Everything.
Yes, it does.
I mean, growing old is a poverty of motion condition. People get less and less and less, and when they are sitting in that chair and not doing anything every day.
They're losing muscle mass and bone mass.
And brain mass.
And
You
brain
don't
mass.
use it, you lose it.
That's right.
Absolutely.
Okay, we've got tons of questions.
Awesome.
Thank you so much. Okay, let's roll through them. Have you ever cured tinnitus? Tinnitus, what is it? For a patient, what do you think the most effective treatment? I've had it for over a year. Tinnitus.
Tinnitus. That is ringing in the ears, and there isn't a cure for that. There are causes that you look for to make sure there isn't a pathological, something you have to intervene, acoustic neuroma, or there are brain
disease,
tumors.
B12.
Yes. Too much aspirin. I mean, there are things that you look for, but there isn't a cure.
Advil and Aleve. I've seen that caused ear ringing.
Yep, it can. Yep. And so you look for a cause, and if you cannot find a cause, habituation, there's different programs that you can learn to have people tune it out. I mean, it's like anything else. When you first put your shirt on, you notice the feeling on yourself, but you forget about it afterwards. So habituation, tuning it out. There is some literature that supports biolipoflavonoids, which is a product that you can buy over the counter. And I've had testimonials from patients that say that it works. It's a food product, and
I like fish. Fish is a good choice.
Yep, there you go.
And
Yep.
I've heard our audiologists recommend niacin.
And I've also heard that, and I've also heard zinc. Although I have one person who had tinnitus from zinc, and numbness and peripheral neuropathy from zinc.
That can happen. Of course, yeah.
So be careful about those things. Okay, I'm 64. Had prostatectomy. prostatectomy. I think prostatectomy is
Prostatectomy.
probably, yeah, prostatectomy about 4 years ago due to prostate cancer. Now I suffer from impotence and incontinence. Is there a surgery that might help with one or both?
Yeah, boy, that's a common question after a procedure like that, and it's a tough question. But you know, the surgeons, I don't think there is really a surgical procedure that I'm aware of. Yeah, I mean, we do use like daily Cialis for the erectile dysfunction part, which does help a little bit, and then just kind of control the bladder with you know, some overactive bladder medications, and just got to limit this. But this can be a side effect. But the cure, hopefully, was prostate cancer, and he'll go on and have a good life.
Although there's a lot of argument about being hyper excited about doing that surgery and catching it early because of that very problem.
And we are learning more and more every year. You know that, and I know that. It's sort of a barbaric cancer to be treating.
Yeah. And what's more, sometimes it just sits there and doesn't do a thing, and then sometimes it kills them.
Yep. I've had PSAs go from 3 to 500 in 1 year.
Yeah. I lost a patient with that very same story.
Yeah.
Has extremely restless legs at night, inhibiting sleep, but not during the day. What's the cause?
Well, the cause is lengthy.
But really quickly, what can he do?
What can you do about it? Well, there are some things, and arthritis of the spine is one of them. Kidney disease, any kind of chronic disease can contribute, anemias, etc.
Anemia is a big one.
Anemia is a big one. Yeah, so that's why I say check a CBC. There are some things we can't do anything about, but is there treatments? Yes, and actually the medications that work the most effective for that are medications used for Parkinson's disease. It stimulates dopamine. And it is effective for a lot of folks.
But not Cinemet, because that's it loses its effect. You have to go higher and then higher, and then when they withdraw.
Cinemet is, I use Cinemet, but I don't initiate. Don't use Cinemet as a first line. But the other drugs like ropinirole or Mirapex, those type of drugs, and we sometimes use benzodiazepines, like the Valium-like drugs.
That's the last. That's the only reason that I use the Valium-like drugs.
Okay.
Bursitis in hip causes pain on standing. The shots and therapy they've tried haven't worked. What would you suggest? What do the experts expect?
Wow,
bursitis in the hip.
Bursitis, so greater trochanteric bursitis. There's a ton of other bursitises that can occur, and so you kind of want to know where this is
bursitis?
at. And so unless you can target that smart bomb called a steroid into that bursi, an anti-inflammatory.
I'll interject that
she's a pain expert.
But I'm also an acupuncturist too. But I think acupuncture can be of benefit to that. I do.
Wow, really?
Yes.
And
it works. She did it on me once.
It works.
Yeah.
Well, there's some question. I mean, there's a lot of argument about whether it works, but you use it.
Back and forth. Yep, it is. But I think it's effective, and it may be effective just from piercing the bursa. Something simple, but dry needling. Yeah.
Try needling it.
Yep.
So here is 80-year-old. What causes Parkinson's? Why do people with Parkinson's have cold sweats, even in the winter? Cold sweats and Parkinson's.
I don't know what causes. I don't know the answer for that. But what causes Parkinson's? It's a neurodegenerative disease, and we don't know why it occurs in some. There's a genetic predisposition, perhaps. Toxic exposures. For instance, in the military, we know about Agent Orange. It is now a service-connected disease.
And do you think it truly did?
Yes, I do. I did. Some herbicides and pesticides have been associated with that. In fact, we see a higher incidence in rural areas of Parkinson's than we do in cities. And so we think it's groundwater contamination, perhaps, and that's very substantiated
Getting
theory.
back to what we talked about this driving here, believe it or not, this is what we do. Not just to our kids, but we talk about Parkinson's. But we were researching this a little bit. 1918, the pandemic, the influenza.
Right.
And this virus caused Parkinson's in some people. And they were worried about the avian bird flu as a possibility of causing Parkinson's if you get the avian bird flu.
And maybe that's it. I mean, it's certainly a deterioration
of some sort,
of some kind in that one part of the brain, the putamen and that region. So the night sweats, Kevin, this is your baby. this
She has
person,
cold sweats.
Well, she has cold sweats. So let's just talk about night sweats, because it can be a lot of great.
Huge.
That's a great internal medicine
It
question.
kind of is, it depends on your age and your sex, obviously.
Yes.
Yeah. So age. Anyone with acid reflux is a big cause of night sweats. But you also worry about other things like the lymphomas and those B-type symptoms that occur with lymphomas, and then just night sweats from hormonal things that occur in postmenopausal women or perimenopausal women. So it's a hard thing to really judge and treat, and unless you want to give hormonal therapy, I use a lot of Zyrtec antihistamine.
Right.
But then there's drugs like Effexor that came out of the Women's Health Initiative study as an alternative to hormonal therapy.
For
Yeah,
night
night
women
sweats,
who are
women who are having hot flashes,
menopausal.
right. Anything else you can think
I was
of?
thinking of tuberculosis, of
And,
course, but we
well,
don't see it.
Well,
but low-grade
worldwide
infections.
we do. Worldwide we do.
And bacterial endocarditis. That's
Yes,
the one I always
correct.
look for, the
Yep,
SBE.
yep, yep.
77-year-old person from Huron, caller has a relative, 50, with neuroendocrine tumors of the lung and liver. What's the prognosis and treatment? Neuroendocrine tumors.
Neuroendocrine. Well, the prognosis.
Pheochromocytoma? That kind of
There's a whole association with it. They can be all over the body. The neuroendocrine, any tumor, but the prognosis is quite good if they're caught early. I'm familiar with the Mayo Clinic has a program over there. There's some specific chemotherapies, and I can't tell you what they are, but they are specific and very specific for neuroendocrine tumors.
Since they pull in a certain kind of cholesterol, you can tag the radioactive or the poison to that. It
Right.
drags it in. It's sort of like radioactive iodine for thyroid.
Yes.
So, there's hope. I was trying to think of the other one that neuroendocrine tumor that sometimes is in the appendix.
Well, that's a carcinoid.
Carcinoid syndrome.
Oh, the carcinoid.
Is that another neuroendocrine? I think
It sort of kind of is, yeah.
it's
They
like
present with hypertension and flushing and hot flashes and
The flushing.
So the word carcinoid wouldn't come. But I
it's
thought
okay.
you're
Carcinoid.
younger. You can remember that. So here's from Aberdeen's urinary tract infections. 2 episodes, no warning, suddenly very ill. What can she do to prevent further UTIs?
Okay, age of this woman?
80.
Wow. Well, some people do take daily antibiotics, but you might want to build the fort up with estrogen, like something like that to kind of help prevent the bacteria from refluxing into the urethra. So just getting that built up.
A lot of times they don't have urinary infections. They've just got vaginitis, and a lot of it's because they were on antibiotics.
Exactly.
Right,
So you
right.
have to do
Probiotic.
an exam sometimes. Yeah.
What's probiotic? Progia? Do you use
Well,
that?
I don't. I usually have the person go to a health food store and buy the refrigerated type, and then they're typically spendy. But I think and I don't have a brand name to give you, but
Our obstetrician uses Progia, and he has them take a half of it in the pill in the mouth and the other in the vagina.
yes, you can use that.
And another thing for anyone, if you have sex, void. I don't know. She's 80
Void
years
right
old.
after-
We can't discriminate. We can't discriminate.
And-
If you have to
After
void.
sex, we're going to recommend
and
that
also-
She voids. Yeah.
Vitamin
These are
C
blind.
is another option.
I love vitamin
I love
C.
vitamin C. I usually use 1,000. I do a lot with my multiple sclerosis patients and have them take vitamin C. It keeps the urine a little bit acidic, so bacteria is not likely to grow.
4 times a day is what I do.
Yeah, a couple of
1,000
times
4 times a day.
Oh, you do 1,000 for that? That's good.
Well,
No,
here's
yep.
my story, and of course, I've looked at the literature, and it isn't great for it. But you have these little ladies in nursing homes, in particular. They come, and the nurse says, "Well, they're not quite right. I mean, they're acting weird. They must have a urinary tract infection." Of course, any bladder. Any UA in those little ladies in the nursing home are all abnormal, so they get another antibiotic, another
Right,
antibiotic.
yeah.
I just put them on 4 times a day, 1,000 vitamin C, and that problem seems to go away.
Wow,
Yeah,
good idea. Great idea. I'm going to take that to my practice. Thank you.
That's a great idea. Well, your wife's the one
do
that
it.
brought it up.
I'm a
talk about bladder
BI. I'm a twice a day.
We don't talk about bladder.
She's a twice a day.
But that's good. I'm good for you.
Taking krill oil. We've got a numbness in the feet. You know what? We've got a bunch of migraine headaches. We've got shingles twice. We're going to talk about grand mal seizures. There's a bunch of questions that we're going to address after this show, so you're going to want to go on the internet. But we've got about a half a minute each. What would be your, Laurie, what would be your take-home message you want to make sure everybody remembers?
Remembers about
What-
neurologic disease.
What is your soapbox? What particular? Let's ask Kevin first, and then you can.
Then I'll prime
you
off
can
of
do
him.
the-
Okay.
What did
There's an epidemic still of obesity. There's an epidemic still of anyone with a lifestyle of smoking and sedentary. So those three issues right there.
Okay, and you've got 15 seconds.
Okay, exercise. Exercise goes along with numerous studies and lots of different neurological disease, not just Parkinson's, multiple sclerosis, migraines. It reduces migraines. So I think exercise, aerobic exercise, is important.
Aerobic. I like running outside, getting outside,
Getting outside,
and
fresh air, vitamin D.
Get the vitamin
Vitamin
D.
D, helpful.
Very good. Thank you both. We'll be right back after this.
What would you do to save your child's life? Secondhand smoke can kill them any number of ways. So, would you stop smoking around them? Would you ask your family and friends not to smoke around them? Would you keep them away from places where people smoke? Of course you would, because you can choose. They can't. It takes courage to stand up for your child. But if you don't, who will?
A friend gave me some feedback a few days ago. Some people say you're arrogant, but I said no, just self-confident. He followed, we need that in a doctor, but you know, there's this fine line between those two characteristics. Oofta. That threw me for a bit. Was it a backward compliment, a subtle and softened way for a dig? No, I think it was honest and a way to tell me what was being said about me, an opportunity to improve myself. As a physician philosopher once said, a true friend will help you grow by pointing out your warts. And instead of getting angry, you should take it as an opportunity to get better. What is arrogance? The dictionary is harsh. An offensive display of superiority or self-importance, overbearing pride. I see it in people who treat others poorly, especially those who are less advantaged or lower on some hierarchy. Examples would be an employer who deals with an employee poorly, a prison guard who harasses a prisoner hatefully, a teacher or parent who supervises a student or child unjustly, or to make the point, a doctor who treats a nurse or patient poorly. I believe nothing indicates the true color of an individual more than how he or she treats someone who may be lower on that totem pole. I have seen examples of physicians acting this way when a surgeon threw a scalpel across the room, when a specialist spoke negatively about a younger, inexperienced doctor, and when a resident treated an old inner-city young woman infected by gonorrhea with disdain and contempt. I'm not proud that my profession probably deserves some reputation for being arrogant. On the other hand, part of the value of a physician provides comes from a sense that she or he is competent and knowledgeable. A humble physician is one thing, but an unsure and uncertain doctor is not someone I would want to guide me with my health problems. Perhaps sometimes I've come off as a know-it-all. I need to work on that because I do not know it all. In fact, the more I do know, the more I realize my inadequacy. My folks came from humble backgrounds, and I was drilled on the golden rule. The last thing I want to do is to portray myself as a physician who thinks he's more important than anyone else. Rather, I would like to be known as someone competent who cares. This brings us to the end of our show this evening. I sincerely thank our fantastic guests tonight who came all the way from Rapid City on their old dime to do this.
Hard to say no.
As often happens on this show, time ran out. We didn't get to all of your great questions, so to hear our answers to more of those questions, please join us now on our website, oncalltv.org, where we will continue live with On Call After Hours on the web in just a few minutes. Our stories tonight from Teresa Binkley and Ken Ivers might be examples of basketball player Larry Bird's theory. If you give 100% all of the time, somehow things will work out in the end. And until next time, go get a flu shot. That's one of the best things you can do in order to stay healthy out there, people.
In the summer of 1816, a young, well-educated woman from England traveled with friends to the Swiss Alps. Unseasonable rain kept them trapped inside their lodgings. To pass the time, she and her alpine companions competed to write the best ghost story. The young woman, Mary Shelley, took the prize when she penned Frankenstein, a classic story of a doctor-scientist who is seduced by the new technologies of the day to create a monster.
Our technology today allows the possibility of recreating his experiment. Are we smart enough to avoid the mistakes of the frightening ethics of Dr. Frankenstein?
Next time on Call with the Prairie Doc.
Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you. Thank you for staying afterwards, and we'll just bomb through a bunch of questions.
Awesome.
What are the chances of developing Parkinson's in South Dakota? Some say we're a pocket for this. Also, is there a diet to combat Parkinson's? So are we a pocket?
Are we a pocket? Anywhere in the Midwest, particularly in areas where we do farming and ranching, and
Seems
seems to be a
higher.
problem. Yes, it is definitely higher.
Yep. And is there a diet that works for it?
Is there a diet that works? Again, getting back to healthy
getting
food.
back to anti-inflammatory. It might be an inflammatory disease. We don't know.
We don't know. I would say the most important thing is an exercise program. I had one jogger who jogged through it until 10, 15 years into it, and he was a physician. Coleman, 2008, peripheral neuropathy extends to the ankles, burns, cold sheets make it intense. Anything besides pain meds that I can do? Peripheral neuropathy.
Peripheral
Lori.
neuropathy. Is anything that's medications probably, it depends on the cause of peripheral neuropathy. The most common cause is diabetes in this country. There's a whole laundry list of other ones. Alcohol, yeah. Alcohol.
Smoking.
Well, smoking can exacerbate it. It's not particularly the cause. You can have peripheral vascular disease that affects the nerves that causes neuropathy as well.
We want to make sure everybody checks their B12 and thyroid.
I know, we do.
Yep,
Absolutely.
B12, yep.
Is it possible to completely recover from a bipolar disease? Kevin?
I don't think so. I just don't think so.
You don't recover.
You always have it, but it isn't controlled. Absolutely.
Remission.
It goes in remission, but you don't recover. And it can always show up.
So don't drop your medicine and say I'm cured.
Don't drop your medicine and say you're cured. Absolutely.
Specific for Dr. Weiss&C. Rapid City vet wants to know why emergency and long-term care is provided, but it is so hard to get dental care.
I agree. I think they should get dental care. I think the veterans should have dental care as well.
And we don't seem to get
We
it.
don't. You have to be, I believe, 100% service connected to get dental care in the VA. Your teeth are part of your body, and if your teeth are in
bad.
abscess, whatever, they're bad. They're part of your body. I believe that it should
And
be.
the nit is for inflammation again.
Of course.
It's a nit for inflammation. And the C-reactor protein, which is an inflammatory protein, goes up with poor dentation.
Pneumonias.
Pneumonias.
Sky high with
Absolutely.
bad teeth.
Bacterial endocarditis of the heart.
Bacterial
Infection of the
endocarditis,
heart. And, it should be part of all healthcare plans.
From Facebook, it's not the quantity we eat, it's the quality that is lacking. Comments?
I mostly agree with that.
Quality and quantity.
I believe it's
don't know.
quality. I do think we got to reduce the quantity.
Both.
You get a nutrient. What he's saying is you got to eat a nutrient-dense, low-calorie food. Nutrient-dense is the quality, and make it low-calorie, and you're going to get enough quantity.
Right. And so the best nutrient-dense things are like sweet potatoes,
whole
broccoli,
fruits and vegetables.
fruits.
And healthy meats and fat, and healthy fats are, fat gives you satiety. You feel full on fat, so you don't have to eat a lot if you eat some
read
fats.
my book. Oh, honey.
But at any rate, It's a balancing act.
It's a balance.
Yes, yes.
It's a balance. So I think quantity is a huge part of it, and quality, and I agree. It's nice that we had a chance to say both.
Both, right.
Caller had a routine physical and was told that he had a UTI, the cultures grew staph. How could this happen when he had no symptoms? 77-year-old man.
You know, you have to look at the urinalysis. You have to see, you know.
Would you treat a guy who's
I don't think I would.
asymptomatic?
Yeah, no, I would not. I think you're going to the risk far outweighs any benefit.
The risk of an antibiotic is significant.
Absolutely,
It is.
absolutely.
77-year-old from Sioux Falls got a shingles shot with a neomycin allergy. Caller has a neomycin allergy. Can he get a shingles shot?
Yes, it's a live virus, but yes.
Yeah.
No problem.
It is it's a beat up
live virus.
It's kind of
Right.
going.
Yeah.
"Ugh."
Yeah, it's frozen.
And it's had a hard life, and it's not very strong, but it's enough to
Semi-attenuated, I think is what they call it.
attenuated.
Yeah.
Did you begin as a 911 dispatcher?
I did.
What? This is.
I love it.
So what's the story?
Yeah, I started out in Sioux Falls. I was a 911 dispatcher. That's correct.
Wow, neat.
Yep,
Someone
yeah.
went, I bet she was
I
that lady.
recognized her.
I know that lady.
You know, by the way, we shared a call together. We didn't even know each other.
Yeah.
I'm a little younger than her, but she was a 911 dispatcher, and the scene is very unusual. But she dispatched people to our scene. We talked about this
scene.
years down the road,
Wow, and you didn't know it.
and we didn't know it. We didn't know each other.
Until after here was
Yeah.
this case.
Oh, it's
I
a
was
huge
a
case.
dispatcher.
I'm going to write a book about it.
Next book.
Can you say anything more about it?
I cannot, but it does involve Attorney General.
Oh. All right, Belfouche, South Dakota. So it was a while ago. That's what
Yes.
it is. I know that. 24-year-old son had first grand mal seizure, had a CAT scan. Should they have done further testing? Grand mal seizure is a CAT scan enough.
Yeah, I don't believe so.
What would you? An MRI.
Yeah, an MRI, and there's a protocol for seizures and in
Lumbar
each,
puncture.
No, if he's not sick, you wouldn't need a lumbar puncture. You look for signs of illness and so on. But yeah, MRI, EEG.
And I would
History.
add, as a general internist, sleep study, panel C, CBC.
Sleep study in a 24-year-old, unless he's obese, probably isn't the first thing. And you get a lot of information about a sleep-deprived EEG about their sleep. So,
yeah?
Oh yeah.
Okay. I think that we under sleep study people. There's so much sleep.
Well, there's a lot of pathology, but hopefully by 24 you don't have that problem, but you may.
There was a study in Australia, 13 years, from 30 to 65 years of age, the people who had sleep apnea. Without sleep apnea had a 6% death rate, kind of what you would expect in that group for 13 years, right? 30 to 65.
Wow.
And those who had moderate to severe sleep apnea had a 33% death rate.
Wow.
Five times higher risk of death who had sleep apnea. Caller has shingles twice after getting a shingles shot, now has post-herpetic neuralgia and eye damage. She's on medication but still having pain suggestions. I would make one comment. I really looked at this literature just lately. The shingles shot doesn't eliminate it, but it reduces,
Yes.
and it by 50% the incidence and by 50% the severity.
Right.
Do you agree with that?
Yeah, absolutely. Yeah.
Post-herpetic neuralgia is far worse.
If you haven't had the shingles shot.
Well, no, I mean, yeah, exactly, and far better or not as bad. The severity of it is not as bad
you've
if
had
you
the
got a
shot.
shot.
And
right.
some of the medicines we talked about earlier too that worked for neuropathic pains, like gabapentin, pregabalin is FDA approved for
Or
that,
Lyrica.
or Lyrica, yeah, and all those other atypical antidepressants, seizure medications, those kind of things. There's topicals, there's lidocaine, capsaicin. You of course don't put that in your eye, but
Right.
those are options as well.
It's interesting. The experts are saying not narcotics, though. Not
Not-
narcotics for
yeah,
post-herpetic
no,
neuralgia.
no,
and it
doesn't work.
This is a very high potential for addiction.
Absolutely.
What do you recommend for migraine headaches that occur somewhat frequently, like 2 to 3 times a month, but are controllable, but infrequently so severe that they are debilitating to the point where I must go to the emergency room?
Well, the triptans, for 2 to 3 times a month, the triptans would be a nice drug if you're sensitive to, and they work.
Like
they're- sumatriptan, Imitrex, Maxalt, those kind of drugs, Zomig. That would be the thing, because you can take that and go on with your day. You know, shots of Demerol and those things that just put you out. No.
But
if you can
prevent it now. I mean, beta blockers.
No, 2 to 3 times a month. You know, that's questionable whether a person will. Yes, there's been a recent study that looked at drugs that are most effective. In that top tier, topiramate or Topramax is an effective drug.
Weight loss too.
Divalproic acid, but that's Depakote. It has a fair amount of side effects, and it requires blood monitoring. And curiously enough, there was one in that top tier is Butterbur. It's an herb, and I've been Butterbur, 75 milligrams twice a day, and it was just as effective. Butterbur, and I've had the opportunity to, and it's relatively cheap depending on where you get it. And of course, you want high quality with your vendor and so on. But I've had patients that have had dramatic results with it. And then you know, there's all the other medications, the propranolol, the calcium channel blockers, etc.
Amitriptyline and
yes.
calcium channel.
Yes, and then chronic migraines, even Botox is a nice treatment.
What causes tingling in the fingers?
Hyperventilation, anxiety.
That's the most common, really.
Common,
and they
yeah.
have numbness around their mouth, and they have it on their hands. And,
Yep.
and what I tell them to is, I don't have them breathe in a bag. I have them go for a walk.
Yeah.
Because you need to breathe
Yep.
faster when you're exercising.
Yep.
And that's tingling perhaps in all fingers, but there's of course carpal tunnel syndrome. You know, that'd be the first 3 fingers, and you could have a cervical radiculopathy that could contribute to that as well.
He and I went to the anxiety. You went right to the neuropathy. So, for $1 million, caller has numbness in both feet for the last 6 months. Causes numbness in pads and tingling through the toes. Uncomfortable to walk. What could be the cause? Well, is that the Morton's neuroma, you think?
Well, it could be peripheral neuropathy, and they didn't give an age.
So you want to make sure the thyroid and the B12 are tested.
All those things that are checked into. You
Heavy
know,
metals.
when you're talking about lymphomas and so on, like serum electrophoresis, you can look for if they have an abnormal protein. Sometimes that's an early sign. Make sure, you know, hemoglobin A1C is checking for blood sugars, and then there's there's such a thing as called tarsal tunnel syndrome as well. Tarsal, but it's like carpal tunnel, but it affects the feet. So that's another thing. Yeah. So there's a variety of things that can cause it.
I like to say that when you have complex things like this, it's really good to get a general internist.
Honey, honey, what do I do?
So you get a general internist to do a nice, careful history and physical
Yeah,
exam.
it's true, very true. But then when you get all done, then you call your
wife.
In my case, it's a cheap consult.
Krill oil for cholesterol and astaxanthin for arthritis. Do guests agree with those meds for these disorders?
If your arthritis gets better, great, I agree. Krill oil is probably very safe.
Yeah, it's an anti-inflammatory, so
and
yeah,
it works.
It's
I've had
expensive though.
Yeah, but if it works.
Fish oil in general, but fish oil, I've had patients tell me they got off their pain meds or their creatinine started rising and they were on NSAIDs or whatever, and they tried these krill oil or fish oil or what, and it seems to help. It's anti-inflammatory.
This whole inflammatory cascade, the anti-inflammatory is the omega-3s, is the fish oil. So this whole inflammatory cascade can be circumvented by taking fish oil.
But there's some good data to say that people do better on fish than they do on capsules of fish oil. I mean, it's the same as with beta carotene and carrots, or it's. I like ground flaxseed.
Exactly. You turned me on that. I wrote about that in my book.
Did you?
Yeah. Give you credit
Did you
for
give
it.
me?
No.
No. Well,
I wanted the credit. I gave Mahatma Gandhi credit though. I quoted him.
Well, there you go.
You're right up there with him.
Oh yeah. Well, that's okay. Thoughts about medical marijuana for pain control, seizures, and Parkinson's? Medical marijuana, any comments?
You know, I've researched this and they wanted me to talk about it, and I do. There is medical benefit, absolutely medical benefit, and if you're desperate, move to Colorado. It's legal.
I do know that there's some arthritis that is really benefited, and I do know that there are people who have nausea and or lack of appetite things that they, but that's a select few.
Select few.
I don't want to be the one
to prescribe it.
They have to prescribe it. I would like to.
It's tough. You know what? Just make it legal.
And there's literature about seizures as well, so that we have cannabinoid receptors in our brain, and then there's. I guess I think it's the question still out there about Parkinson's disease, but I've heard numerous testimonials, of course, over the years. It helped me.
And there's also a
um,
gene that gets turned on in certain people to cause a schizoaffective disorder when they smoke it. The
So they get schizophrenic.
Exactly. Yep.
Sure.
So they,
I think it has to be, certainly some regulation, and but I'm not going to close my mind to anything as a physician.
No, we want to help people.
Yeah. There you go. Caller has autonomic neuropathy. Autonomic neuropathy, that's another thing, particularly with Parkinson's, they get autonomic.
Is that
Scheidreger's,
right? Gosh, interturns.
You were so smart. Who could say Scheidreger's fast enough?
Faster than me.
What drugs can be used to help her condition? She has low blood pressure, of course. That's it.
We treat that. You treat that.
Yeah.
Drugs like glucocorticoids, of course, and you have to make sure that person doesn't have issues with congestive heart failure. You need to, or at least monitor for those things. Glucocorticoids, proamantine. There are drugs that have vasoconstrictive properties that can help with that, and there's also,
but they're expensive.
Oh yeah, they're very expensive, and using compression stockings, those good old things. Drink Gatorade,
broth. There you go, broth.
Gatorade,
yes. And support.
Yes.
But I like the idea of support hose. That's really underdone. It's important, huge.
They hate me for it, but
they never like it.
Nobody likes it.
Although I had one lady, I begged her to do it. No. Finally, she got into trouble. I got her wearing hose, and she came back and she was mad at me. Why didn't you force me to do those hose? I had that chance of getting that help all that a long time, and you didn't help me. You can't win.
No, you can't.
Can't win.
Has shoulder, upper back pain whenever clothes touches the area. Doctor doesn't know what's wrong. Any ideas what the problem be? So this is a shoulder neuropathy. I've got a guy who's got brachial plexus disease.
I mean,
can even shingles? Post-herpetic?
Yeah,
there it is.
Post-herpetic, or you hadn't noticed, of course, yeah, because you don't always see that area. I mean, so that is something to think about. And sometimes, even before you actually have blisters, months, and it's been reported years before, there's pain in the dermatomal areas where that virus is trying to come out and do it. So that's a possibility. You can get entrapment of nerves coming off the scapula. I mean, there's a variety of things that can happen. Chronic neck muscle spasms from poor posture back here. There's a thing called notalgia paresthetica, and that actually more typically causes numbness in the back here, but sometimes you get hyperirritability as those nerves pierce the trapezius muscle and they get pinched.
So I would say, for one thing, have your doctor prescribe a prescription for the treatment for shingles and just see if it helps. This zoster cine herpeticum, this herpes zoster without the rash can occur.
Great.
And I think it'd be worth a trial.
It might be worth a try.
And even you doing
pretty benign.
Or gabapentin?
Or try some gabapentin, yeah. Caller has had a low white cell count for 15 to 20 years, 2.7 to 3.3. Should she be worried about cancer?
I just monitor it and just keep monitoring it. And,
15 to 20 years.
Not likely
keep
an issue.
monitoring it.
And medications are often
the cause.
The cause, and you might want to look through that list, but that doesn't mean you have to go off them if it's that. That's okay.
And there's probably, I bet she has one of those inherited things.
And just get an infection, she'll get that up.
Yeah. It'll go up if she gets it.
Or take a course of steroids.
Yeah, one or the other. Don't worry about it.
Yeah, I think it's okay.
You get a sign of infection, get to the doctor. Ipswich, hip surgery, new kind, cutting from the front or cutting from the side. What are the benefits from cutting from the front?
Wow, I have some pretty good success stories
with the new hip surgery.
Yeah, and so the patients are seeking out those surgeons that are doing that, and
Hearing good things.
I mean their downtime is a lot less. It's incredible. I love technology.
It is.
Advances in medicine. Let's keep going.
But not for everybody. There's
not
some
for everybody.
people.
Yeah, not everybody qualifies for it. Yep.
And the last question.
Okay.
I'm a 79-year-old plus female with pulmonary hypertension. I have severe time breathing, even if walking a few steps. Do you have suggestions on help? It's gotten much worse the last 6 months. Finally went to a lung doctor at Avera. He's doing tests, and I'm very low on oxygen by the tests. I'm to sleep over on October 30th next week. I'd appreciate any help. So, pulmonary hypertension.
Needs
Ken.
oxygen, it sounds like. I mean, it's the lung pressures are high. Weight loss would help, obviously. And she needs, obviously, the lung doctor's aware of that, but they're doing a sleep study, I'm sure. And you worry about blood clots, recurring blood clots.
That's right. And so, I mean, I think the idea of, but if you've got primary pulmonary hypertension, which is no cause, you have no,
Right.
then they treat it with sildenafil.
Viagra.
Generic, 20 milligram
yeah.
Viagra. It's cheap.
And the drug of choice for high altitude climbing.
Really?
Yeah.
Altitude
Yeah.
sickness.
Okay.
So if you do the 14Ks in Colorado, trying to treat your Parkinson's,
Take your Viagra
take your
first.
Viagra.
Take your Viagra, and you have, I won't go there. So, thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. Be sure to join us next Thursday at 7 p.m. Central Time on South Dakota Public Broadcasting. Call in or email your questions. Watch Prairie Doc Perspective column on your local newspaper. Listen to our Prairie Doc Conversations radio show on a station near you, and follow us on Facebook, Twitter, Pinterest, and don't miss next week's show on Frankenstein. And so until next time, get a flu shot and stay healthy out there, people.
Very good.
Thanks.
Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medical Care Quality Improvement Organization for South Dakota. Additional funding is provided by Aberdeen Asthma and Allergy, Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Care, Dakota Dermatology, the Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, and Swiftel Communications. Closed captioning for our On Call with Prairie Doc is provided by generous support of Avera, Brookings Health System, and Fishbeck Financial Corporation.